I would like to give a shout out to 3 active bills in Congress right now that I have looked up, and I wanted to get them right. H.R. 5343, Buddy Carter, probably one of your members. I think he's a pharmacist.
Yes.
Senate.
He's the only one.
Thanks.
He likes to make that very well known.
Georgia first. S2553, Senator Stabenow of Michigan. S2554, Susan Collins, to allow pharmacists to tell my patients, or their patients, our clients, when in about, I think, 10 or 20% of moments when they're getting their medication at the pharmacy, that it's actually cheaper to pay cash than it is to use their insurance. And I think probably everybody on the panel would agree that that's a good thing, and we should allow that, codify it into law. But and that seems to be pretty popular. I wanted to plug those bills to give them a little bit of traction.
And 11 states have passed laws on that, the gag rule.
We're getting a lot of traction on that around the country. But then what's the next step after that? I think, to my earlier comment, just having some more transparency in the process, whether it's having the information at my fingertips of what a drug is costing and what, more importantly, what it's going to cost to the patient when I'm prescribing it, and putting that information into the conversation about risks and benefits in the bigger sense would be great.
I appreciate the plug. Thank you. You shortened my remarks. In the category of active bills, you know, given that I saw recent stats from 2020 data, so it's likely higher. The U.S. spends over $600 billion on medication-related errors in the healthcare system. And the fact that no other healthcare professional has more medication expertise than the pharmacist, I think having the pharmacist more involved within providing medication management and type services. So H.R. 592 and Senate File 109, which has more than 50% of the Senate signed on, as well as over 60% of the House, very bipartisan, which allows Medicare Part B to pay for pharmacist services. We'd strongly encourage that bill. It happens to focus on those in medically underserved communities, so it's where there's not enough providers currently. This would help to have a healthcare professional engaged earlier in the treatment of a patient, and also focused on the management of their chronic disease.